Hello, everybody. My name is Kate Binford, and I chose to explore the hospital social work career. And as I did some research, I found that these workers are also called medical social workers. And I like this definition. It says medical social work primarily focuses on supporting patients and their families in hospitals, community clinics, and other healthcare settings by coordinating patients' care with the larger medical team. And you'll see that that is just a small portion of what hospital social workers do. There we go. Okay. I chose to explore this career because my mom just had surgery in December and it didn't go super well. So we were at the hospital quite a bit. She had back surgery, and I noticed that there was a room that had a label on it that said social worker. And I had no idea that social workers were in hospitals too. So that was intriguing to me because I've always had an interest in healthcare and going into the medical field, but I also want to do social work. So kind of combining the two of them, I thought would be something really interesting to look at. Social workers in the hospital setting provide very valuable insights and care for those patients who are in the hospital. I put some bullet points of things that they do, but the list is very minimal compared to what they actually do because they have a very wide variety of things that they perform in the hospitals. But some of them are to provide the emotional and psychological support that patients need as they are going through these traumatic events or crises that are usually unexpected. It's important to have someone there that is trained in knowing how to counsel patients. They also do assessments for those coming into the hospital, which are usually psychological assessments. And then they are involved in creating the treatment plan with doctors. And usually the insurance companies rely a lot on those assessments as well to know how they can best provide care. And they also connect patients and families with the necessary resources, not only in the hospital, but outside the hospital once they leave, making sure they have everything that they need. Um, like I said, they work with insurance agencies to help cover the cost of treatments. A lot of times people come in without insurance and they need help knowing how they can still receive the care that they need without it putting them in a lot of debt. Something I thought was interesting, they develop healthcare policies and advocate for patients' rights. Um, one of the quotes said that social workers go to war for the patient a lot of the time. They also conduct training. I thought this was really neat because they meet with the whole medical staff and they're constantly looking for ways that they can improve as a team. And this is led by the social worker to help meet the patient's needs. They also provide patient education. So for those that come into the hospital and they have no idea what this new diagnosis is, the social workers will come to the rescue and teach them more about how they can take care of themselves and navigate their new situation. A big thing that is seen in some hospitals is substance abuse counseling with those that come into the hospital. This could be more in ER settings, but a lot of the time they'll come in and test positive for having drugs and alcohol in their system. And so the social worker will come in and give abuse counseling, so substance abuse counseling, and abuse counseling in other cases too. But overall, they help patients get the care that they need while they're at the hospital and beyond. The education required to be a medical social worker seems pretty similar to other types of social workers. They need a bachelor's degree, preferably in social work, but it can be in a related field. They also need a master's degree from an accredited program, and they need quite a bit of field work. It said 450 to 1,000 hours of experience, and it said that at least one of your internships should be in a hospital setting. And that's because social workers in hospitals don't just need to know about social work, but they need to know about the medical side as well, because they're doing a lot of work with the medical team, and they need to know the terminology and how to communicate in an efficient way about their patients. And that requires a lot of experience and just knowing about how hospitals work and how they can best work with the doctors and the nurses. After the field work, then they can go on to take an exam, which is administered by the Association of Social Work Boards. And after they pass that, they can become licensed. And after that, it's important to maintain the licensure that they obtain, which is different for each state. So a lot of times, if you get your license in Utah and then you move to, say, Nevada, you would need to get different licensure because they have different requirements from state to state. Right, so the current job prospects, there are actually quite a bit of jobs for hospital social workers that I found that were available, and there are many different settings that you could work in. One of the main ones I saw were crisis work and case management in hospitals. Some other ones that I thought were interesting were working in a women's and children's hospital. So helping, kind of specializing in women and children and helping them kind of understand maybe diagnoses or after women give birth, being there for them in that way. There also are jobs open in dialysis centers, hospice centers, rehab centers, doctors' offices, nursing homes, outpatient centers, and home health agencies. So most places where there is medicine or medical care being provided, there are typically social workers nearby as well in case they are needed. The salary range for social workers in the medical field actually varies quite a bit. So the low is 46,000, average is about 78,000, and the high is 131,000. And it honestly varies a lot from state to state, but Utah has one of the higher salaries for medical social workers. There were many things I found interesting about social workers in hospitals. But I really liked how it said that medical social workers act as advocates for the patient. And I just thought that was cool that you get to fight for what the patient needs. And they also are a part of the medical care team, which I really like because I think doctors are cool. And getting to know how hospitals work would also be very interesting. I looked into kind of how to have contact with social workers because in the hospital setting, because I've never really had contact with them when I've been in the hospitals. So I was looking at Intermountain. It was Primary Children's, and it said that social workers are available 24 hours a day to help their patients work through fear, grief, family conflict, child behavior problems, and to communicate to the medical team and create a care plan. So I thought that was cool how they had information about the social workers pretty readily available online for the patients. One of the sites that I found had a lot of testimonials and personal experiences from the social workers that have experience in the medical field. So I wanted to share some of those. I know for me, it helps to have more insight from those who have experience with it. So it's not just like a list of their job description. This one says that I conduct psychological evaluations of every patient and family that gets admitted to the service, and insurance companies often utilize these evaluations as part of the transplant authorization. In line with general social work practice, I am constantly assessing safety and risk, access to resources, mental health, financial concerns, and available support networks. I just like that last line where it talks about how everything that a medical social worker does is in line with what they learned to be the general social work practice, with continuing to assess safety and risk, access to resources, mental health, and financial concerns, and looking for available support networks. So it's while you are in a medical environment, there is a basis of social work that you do. The next one says, in describing her work with pediatric bone marrow transplant patients, Mrs. Beach said she helps explain to the patients with age-appropriate language the reason they are in the hospital and getting this type of treatment. And I also support the siblings. With my child life specialist colleagues, we prepare patients for certain procedures and teach them strategies to reduce anxiety, depression, and stress. I help the medical team understand a family's cultural perspective and help a family understand the medical team's recommendations and treatment plan. With parents, I encourage self-care and mindfulness activities to help with the stress and strain of hospital life. Mostly, I engage in active listening, provide emotional support and validation, and bear witness to the challenges and triumphs of our lives. And with this slide, I just wanted to ask a question. I know that this kind of poses a lot of amazing things that hospital social workers can do to help families and individuals that come through the hospitals. I wanted to ask, how do you think your experiences in a hospital that you've had may have been different if you had interaction with a hospital social worker? This next one says, at John Muir, our social workers are assigned to different floors. We have 9 different social workers per day, and the assignments are as follows: trauma intensive care, neuro-intensive care / progressive care unit, emergency room, acute rehab, neuroprogressive care, pediatric intensive care, mothers on labor and delivery / pediatrics, neonatal intensive care unit, and mothers of these neonates, trauma, med, surge, ortho, med, surge, oncology, med, surge, oncology surgeries, renal, med, surge, general surgeries. So I know that was just a lot of sciencey words, but I just put that in here because it shows the variety and scope of how involved social workers are in the different facets of hospitals and how much they really do need to know about medicine. So I thought that was interesting. One more. So this I appreciated how honest she was in this. She says, my advice is to get out in the world and practice this kind of work before you really commit to it as a career. It is very taxing, said Jessica Beach, LCSW, who works in the pediatric bone marrow transplant service at UCSF Bianoff Children's Hospital. Get to know yourself and your triggers and vulnerabilities before engaging in intense relationships where people's emotions and lives are at stake. So, while I feel that being a hospital social worker would be very rewarding, it is helpful to know that it would be very taxing. She goes on to say that she relies heavily on the people that she is surrounded by, that she works with, and her team, as well as therapy, and that she couldn't get by without it because it can be heavy at times to be around these high levels of stress in the hospital setting. So with that, the question I wanted to ask, besides the taxing nature of being a hospital social worker, what other challenges do you think when working as a hospital social worker would face? And what resources could help them work through these challenges? I would love to hear your thoughts. Here are my references. Thank you so much.